Well, the 9th South African AIDS Conference kicked off in Durban yesterday, and this year's event focuses on scientific, social and digital innovations and their potential to control and manage the HIV/AIDS pandemic. eNCA's Mawande Kheswa is on that story. He joins us now live from the eNCA Albert Luthuli International Convention Centre, and that's, of course, in Durban. Mawande, I suppose funding for HIV prevention, that will be surely one of the issues that advocacy groups in particular will be lobbying for.
That is indeed the case. In fact, AFNI, which is a regional advocacy group, is driving that conversation as we speak. And I was able to get in Tandoyola from the advocacy group to just exit and just speak to us. Can you tell us about this concept that you are driving of financing prevention?
So I think, thank you, Mawande. One of the important things that we're really highlighting here is the importance of ensuring that the research that we're talking about, especially this conference, is really not left to communities, but there are a lot of commitments that have been made by different governments in Africa. And I think the important point that we're really making is that governments should really meet up to those declarations and meet the targets that have been set around ensuring that we invest enough in research. And I think as part of that, one of the most important things is that HIV prevention specifically is one area that seems to be lagging behind. And one of the cases that were made at this conference is that as South Africa, as an example, we have made a lot of strides in making sure that unborn babies are prevented from getting infected with HIV through a PMTCT program. Now, these babies have been born without HIV, and fast forward to about 10, 15, 20 years later, we are at a case where we are not doing enough in really making sure that the same babies who were prevented from being born with HIV are now not accessing the correct HIV prevention programs. So we are really calling on ensuring that we scale up HIV prevention, we invest in HIV prevention, and one of the key areas of ensuring that HIV prevention thrives is that there should be the appropriate investment in terms of finances, in terms of programs, in terms of health systems to ensure that we achieve as much as we want, to ensure that there is no more person who is HIV negative who gets HIV tomorrow.
One would say that one of the key developments that has been made is the introduction of PrEP. Surely that goes in line with what you are fighting for in ensuring that down the line those babies do not end up being adults and then they contract HIV and AIDS. The existence of PrEP, is it not assisting in aiding that call?
So precisely, PrEP is one of the innovations that we have got. We have, for the longest time, relied on ABC, which is abstinence, be faithful, and condomize. And that has not really given us as much as we want for HIV prevention. Now, PrEP is one of the additions into a basket that we need for HIV prevention. Now, PrEP is good, and it is a new thing, and and there are efforts, and there is a need to, in fact, make sure that these efforts are also scaled up in a very aggressive way so that everybody who needs PrEP, everybody who needs an additional tool for HIV prevention gets it. However, PrEP is not a magic bullet. So we need additional research that is going to ensure that we have as much more products that are going to be accessible. One of the young people is telling us that actually there is PrEP, however, I have a burden of having to take a pill on a daily basis, and I am well. And so that's one of the issues that we're dealing with. So, and within the context of PrEP that you have to take on a daily basis, we also need, we have an issue with a lot of people who are HIV negative, who actually think I will never really get HIV. And this is what we call a perception of HIV risk. So the programs have got to really speak into ensuring that people realize that HIV is still existing. We're still having about 1,000 HIV infections that are happening on a daily basis in this country. So therefore, people really need to be aware and conscious that, I am at risk for whatever reason of contracting HIV. And there's a range of products and PrEP is available, but we do need an additional basket that really will expand the tools for HIV prevention.
In closing, you're saying that the community cannot do it alone. What call are you giving out to government in financing prevention?
So the call is, is to really make sure that we invest in research, and research really within the context of health is very broad. We talk about broad research that is funded as an investment, but within the broad budget of research, there should be, the broad funding of health, there should be specific research funding that goes into ensuring that actually we have a lot of knowledge that we generate so that we get better ways of understanding. How do we implement the tools that we have? How do we strengthen the health systems to really ensure that people have access to all the modalities that they need so that they can prevent HIV, they can access health services, sexual reproductive health services, and a whole range of health services that young people need in the country.
Thank you for your time. We'll let you just go back and understand that you are part of that panel. We thank you very much for your time. Dando Yola there of AFNI, just speaking about the fact that they are all for the financing of prevention as they seek to have an Africa with zero new infections. And one of the ways to do this is for government to invest more in research to ensure that there are more additional innovations and methods that are used to prevent HIV and AIDS from spreading and more people getting infected. And one of those ways that has already been administered is PrEP, but he says that that is not a solution that will solve all the problems. It needs to be accompanied by new research and development that needs to be instituted.
Yes, some incredibly important conversations taking place there at the 9th South African AIDS Conference, and it kicked off in Durban yesterday. It continues today. That's my colleague Mawande Kheswa, who's tracking that story for us.